Hello everyone, myself Dr. Vanitha D. Revankar from the Department of Conservative Dentistry and Endodontics, Vinayaka Mission Shankaracharya Dental College. The topic for today's discussion is prevention of dental caries. Now this is the overview. Now coming to the introduction, dental caries is a highly preventive disease, and although in most developed countries its prevalence has declined, but still the dental caries still remains a major public health problem. Now the definition of dental caries is, it is a irreversible microbial disease of the calcified tissues of the teeth, which is characterized by demineralization of the inorganic portion and destruction of the organic substances of the tooth if it is not treated on time, which will lead for a cavitation. Now coming to the needs of prevention of caries. First thing is, the type of treatment of dental caries is intensive and expensive as well. Due to decay in the tooth, patient not able to masticate the food effectively, compromising in the nutrition. Dental caries also results in dysfunctional speech, and dental caries, if it is not treated in early stage, results in the pain. Now coming to the aims of prevention of dental caries. First thing is limiting the pathogen, to limit the pathogenic growth and metabolism of bacteria. Second comes the limitation of caries activity. Then comes the early detection of the incipient caries and identification of high risk patients for the dental caries. Now coming to the levels of prevention of dental caries. First thing is primary prevention, next is secondary prevention, and third is tertiary prevention. Next comes the primary prevention in detail. It is the action taken prior to the onset of the disease, which removes the possibility that the disease will ever occur. Now measures taken are by plaque control program, caries activity test, patient education, topical application of remineralizing agents, and through the Pitt and Fisher sealants. Next comes the secondary prevention. It is for limiting the progression and extent of a disease as early stage as possible after the onset of the disease. Now measures taken are by preventive resin restoration and pulp capping procedures. Next comes the tertiary prevention. It is for limiting the extent of disabilities once a disease has been caused any functional limitations. The measures taken are by complex restorative procedures. Next is methods to control the caries. First thing is chemical methods, second is nutritional methods, and mechanical methods. Coming to the chemical methods. Now these are the substances which alter the tooth surface or the structure. It interferes with the carbohydrate degradation through the enzymatic alterations and interfere with the bacterial growth and metabolism. Now coming to alteration of the tooth surface or the tooth structure. Now the chemical agents are fluorides, then comes the iodides, then bigonides, silver nitrates, and zinc chloride and potassium ferrocyanates. Now coming in detail about the fluorides. Now what is the mechanism of action of the fluoride? It increases the enamel resistance, it increases the rate of maturation of the enamel surface, remineralization of the incipient lesions, antimicrobial activity, and it improves the tooth morphology as well. Now coming to the delivery methods, that is topical and systemic. Topical is self-applied in the form of dentrifices, mouth rinses, and gels. Professionally applied is fluoride, varnishes, solutions, gels, and fluoride containing restorative materials. Now coming to the systemic fluorides, that is water fluoridation, salt fluoridation, milk fluoridation, and fluoride supplements. Now coming to the systemic fluoridations. So what are the different techniques of systemic fluorides is water fluoridation, that is fluoride in a communal water supply so as to achieve maximum caries reductions. Next come milk fluoridation. It is the addition of measured quantity of fluoride to bottled milk. So mainly recommended for the growing children, and the dosage is 2.2 milligrams of sodium fluoride, and fluoride tablets, that is fluoride supplements, offer an alternative source of systemic fluoride. Can be given in the form of a fluoride tablets, fluoride drops and lozenges. Now coming to the topical fluorides. Now what is the topical fluorides? Here there is professional applied topical fluorides, that is prophylactic paste used in high risk caries patients. It supplies fluoride in one step. It also contains zirconium silicate as a abrasive particles. Now fluoride solutions, that is examples are sodium fluoride, which is containing 9000 ppm of sodium fluoride in 2% sodium fluoride given, stannous fluoride containing 8%. Now coming to fluoride gels, that is acidulated phosphate fluoride, in that is APF, containing 1.23% of fluoride. Coming to fluoride varnishes, they are effectively bactericidal and caries preventing agents, provide high uptake of fluoride into the enamel. It is cost effective. Next comes self applied fluorides, that is dentrifiers. Different types are there, that is sodium fluoride, stannous fluoride, sodium monofluorophosphate, paste in the form of a paste or a gel, more acceptable to the young children. It has fluoride salts and abrasives as well. Coming to the self applied, that is fluoride mouth rinses, sodium, that is the examples are sodium fluoride, APF, that is acidulated phosphate fluoride, along with the topical or systemic applications. Next comes to the chemical methods of fluoridation, that is chemical methods. Chlorhexidine, that is biguanide agent, antiseptic, they are antibacterial, they are effective anti-plaque agents and thus potential against the caries. Now disadvantages of fluorides and bisgonides. The first one is it stains the tooth surfaces, it causes the bacterial resistance, bitter taste, causes the mucosal irritation and has allergic reactions. Now the chemical agents which interferes with the carbohydrate degradation through the enzymatic alterations are vitamin K. It prevents the acid formation in mixtures of glucose and saliva. Sarcosides, that is sodium N-lauryl sarcosinate and sodium dehydroacetate agents. Then next one is agents which interfere with the bacterial growth and metabolism. They are urea and ammonium compounds. The mechanism of action is these are the anti-karyogenic agents, especially against the gram-positive bacteria. There is one more agent which is chlorophyll, which reduces the fall in the pH. The agents which interfere with the bacterial growth and metabolism are nitrofurans. These are bacteriostatic and bactericidal, which is effective against the aerobic and anaerobic bacteria. Next thing is antibiotics, that is examples are penicillins, erythromycins, kanamycins, and with the help of a caries vaccines reduces the caries activity. Now coming to nutritional methods, that is restriction of the refined carbohydrate intake, avoiding sugar in between the meals and consuming more amount of phosphated diet. Now coming to the chemical methods, the foods with anti-karyogenic effects, that is milk containing lactose, that is they are least karyogenic agents. Cheese, that is containing casein phosphatase, fibrous foods which are raw vegetables, sugar substitutes and artificial sweeteners, examples xylitol, mannitol, sorbitol, and consuming more amount of green and black tea. Coming to xylitol, the mechanism of action of xylitol is it prevents Streptococcus mutans from binding to the sucrose. It neutralizes the plaque acids, it increases the salivary flow, bacteriostatic, and enhances the remineralizing activity on the enamel surface. Next thing is dental erosions. Dietary acids in the form of soft drinks, fruit juices, vinegar, which causes the dental erosion. So prevention is not to brush the teeth for at least 1 hour after consumption of such foods and drinks. The mechanical methods for prevention of dental caries is with the help of oral prophylaxis, tooth brushing, interdental cleaning aids, disclosing agents, oral irrigators, detergent, foods, salivary stimulants, Pitt and Fisher sealants. Now coming to the oral prophylactic measures. Here it decreases the formation of dental plaque by careful polishing, that is by doing the scaling of the in between the interproximal tooth surface. Next comes the tooth brushing. The different types of tooth brushings are manual, powered, sonic and ultrasonic techniques, ionic techniques. Now the different methods are modified Bass method, Charters method, circular method and sulcular method. Now coming to the sulcular method of tooth brushing. This is one of the most commonly and most efficient technique. Here we place the bristles along the gum line at 45°, brush outer and inner surface of 2 to 3 teeth using the vibrating back, forth and rolling motion, vertically behinding front teeth by up and down strokes on occlusal surfaces using back and forth scrubbing motion. Interdental cleaning aids are dental floss to remove the plaque and dislodge irritating matter between the interproximal surfaces. They are available in the nylon, yarn, Teflon materials. There are different types, that is waxed and unwaxed, used in where interdental papilla fill the interdental spaces. Next is interdental cleaning aids. So here we use dental floss used to clean in interproximal areas between the teeth, holding the floss between the fingers using up and down at gum line areas. Next is wooden sticks. The different types are soft, triangular, wooden toothpicks. It is used in patients with gingival recession mainly. Next comes the interdental brushes. Here the types are cone shaped brushes used in patients with the wide interdental spaces or the gaps. Now coming to interdental cleansing aids with the help of a single tufted brushes. These are single tufted and it is used mainly in the areas of malaligned surfaces. Next is disclosing agents. These are available in the form of a solutions, tablets and wafers. It contains mainly erythrocin and it stains the bacterial plaque. Oral irrigators. These are flushing devices used to deliver the antimicrobial agents mainly between the interproximal surfaces. Coming to detergent foods. Here the fibrous food prevents the dislodging or the lodging of food between the interproximal surfaces. Next comes the salivary stimulants. These are antibacterial agents. They have buffering and flushing actions. They are mainly used in the xerostomic patients. Coming to pit and fissure sealants. The different types of pit and fissure sealants are glass ionomer sealants and resin based sealants. Coming to the current methods of prevention of caries are lasers, genetic modalities, polymeric coatings, caries vaccines and active and passive immunization. Now coming to the use of lasers, mainly carbon dioxide or erbium YAG, they have shown to exert carious preventive effects. It reduces the demineralization on the enamel surfaces. Argon laser is also used. Now coming to the carious vaccines, it is nothing but suspension of attenuated or killed microorganisms administered for the prevention or the treatment of infected diseases. It stimulates the production of protective antibodies. Coming to the active immunizations, injections of Streptococcus mutans will be given to salivary glands to increase the salivary IgA antibody levels so that it helps in the prevention of dental caries. Next comes the passive immunization methods. Here monoclonal antibodies are produced in the bovine milk by immunization in the cow. So there are other techniques are egg yolk antibodies, transgenic plants, etc. Now newer approaches to vaccines. These are by production of synthetic peptides, coupling with the cholera toxin subunits, fusing with salmonella and liposomes. Now the prevention, the infant oral health care techniques are mainly the guidelining to the parents. They should bring their child for her first dental visit, avoid frequent using of bottles with the sugar containing milk or the drinks, that is nursing bottle, which causes nursing bottle caries. Clean the gums and later teeth with a soft brush after every meal or before going to sleep. Prevention is better than cure. It is important that we as dentists should focus on treating not only those who are ill, but also to treat those who are more prone to likely to get ill. Thank you.